Welcome to OrthoPod, a podcast about the people of orthopedics and their stories. We understand that we all play many roles in our careers and lives, and it is these very stories that ultimately inform our successes and failures. Hi everyone, this is Mo Bendari from OrthoPod, and we have another excellent guest today, Sheila Sprague. I've known Sheila for decades, so we'll have lots to talk about. But let me start you off with a bio. Sheila is a clinical researcher with expertise in the design and conduct of large randomized trials, observational studies, systematic reviews, and scoping reviews. She obtained a doctorate degree in medical science from the University of Amsterdam and a Master of Science degree in health research methodology from McMaster University. She became a member in the Department of Surgery in 2014, a faculty member, and serves as an associate faculty member in the Department of Health Research Methods, Evidence and Impact, and she's been doing that for about 2 years now. In addition to her faculty appointments, she's been long-standing member and associate director of the Center of Evidence-Based Orthopaedics at McMaster University, and that's just a few of the things. She's got tons of how many publications do you have now, Sheila?
I think I'm at about 175.
175 papers. So welcome, Sheila.
Yeah, thank you.
And let me go back to, if we can, when we first met. Now, I recall we first met, now I'm going back, 1996?
It was 1999.
1999. Okay, so 1996 would have put me into my second year of orthopedic residency, and I think that's probably when I decided that I was going to try to get some time away and interact. Now, I had met Gordon Guyot probably 1997 or in that ballpark, and thereafter, we had started this journey, which is the acronym is called the SPRINT trial, but it was the study to evaluate tibial fractures that are outcomes associated with tibial shaft fractures. So what do you recall in terms of our first meeting, and then let's go from there.
Okay. So I finished my undergraduate degree at Waterloo, University of Waterloo, in 1999.
Right.
So in May of 1999.
You started?
I started at McMaster as a research assistant in the Department of Surgery.
Okay.
At the Surgical Outcomes Research Center.
Okay.
With Sonia DePau as my manager and mentor at the time.
Okay.
And then my job there was, my time was divided among several different surgeons. And you had a little bit of funding, I think like $10,000 or something, and you were able to pay for my time to help starting out on your projects. Do you remember our first project?
I think I remember our first project.
I have two, and I can't recall which is quite first.
Sure.
It's either the chart review of tibial shaft fractures that Brad and I went through thousands of, not thousands, it felt like thousands
I think
of
even
charts.
before that. I think there's one before.
And there was a survey?
The survey? And we did one on the quality of randomized trials together, I think, too. And you did a lot of work on blinding and some things like that, right? So we did a lot of reviews back then. But let me take even a step back.
Yeah.
The thing that you've been a frontline in every possible way when we think about research, but you've said it to me multiple times, right? That we don't promote research coordination as a functional career path. So how did you even come into research from your training in Waterloo? Because there isn't a major degree program that would have been back then around research. No. So how does someone get into research in the coordination in the early stages?
I think everyone's path is different.
Yeah.
And like my path, I finished my undergrad degree and I wanted to join the workforce. I knew I'd want to do a master's down the road, but I wasn't really sure which master's to do. I wanted to take a break from school. So I started to apply to different positions.
Right.
And this one was, I think, the second or third job that I applied to.
Yep.
And my course at Waterloo had a lot of research courses. They had like a stats course, a research methodology course, like a thesis type independent research study course, a program evaluation course. So it provided a bit of foundation, for at least getting started in research. But I will admit that I didn't know that this job existed until I was interviewing for it. I had no idea what I'd be doing. I'd never been in an office before, or like I didn't have a summer. I know not now. A lot of people, or maybe back then too, people did internships in the summer and stuff. But I had never worked in the field or anything. But I think Sonia and Vade Tandon and Bob Hansabout.
There's so many people
they took me on, even though I was coming out of straight out of school. And I think Sonia was quite at the interview. I remember her vividly being very excited to hear about this program, and that there is a program that was offering some research
that's great.
oriented courses.
So when you look back now, and it's always hard because you have a different viewpoint having been through it all, right? And now you
I'm kind of unique in that I did my
yeah.
doctorate older, and
Yeah.
so I did it 10 years into work versus going straight through the steps of school.
Right. What was some of the advice that you received back then? And I'm going to ask you two things.
Okay.
What was some of the best advice you received that you thought, you know what, back then it was true and it's still true now? And what was some of the worst advice that people will say, right? Because people give you advice, all kinds of things about your life and career. And I think it's instructive to think about both sides of the story, because I've been given some not so great advice, and I'm happy in some ways I didn't take it, but I took a lot of bad advice and I went in those pathways. You know, you slam shut and think, but you learn from that. So what were some of the things you look back at that time when because you were making some big decisions too, right? You're early in your career thinking, is this what I want to do? I think a lot of people have that. A lot of coordinators start off thinking, where's the future in this, and what do I do, and how do I advance myself? You've gotten all that, so how do you look back at all that? I think
one of the turning points was like a year into my job in Department of Surgery as a research assistant. I was kind of at the stage of you had full-time funding for me. You and Gordon Guyatt had full-time funding for me, and it was a really hard decision to do I switch over to run this big multi-center trial with 1 year of work experience. And
right. It was big scary, wasn't it? I mean, that's the
and
point,
I think the advice, like my mother, I taught my mother a lot, and I remember her saying, like, you know, you and Mo seem to work so well together, so maybe you should just stick with, like, you could probably have a great career working with him, collaborating with him, and I think she could just see our good working connection, and I think that was some
that's interesting,
like, good advice,
because it is scary, right? I mean, so two things you bring up, and not everyone was going to be aware, but Sprint is a big was back then, and back in 1998 is probably 1998 2000 when we got real funding for it, was a fairly large undertaking. Like at that time, like I'd never done anything that big. Gordon Guyatt, who I'm sure will be on one of our guests at some point, we'll sit with him and talk to him about stuff. But he was also taking on something big for the first time. He's done other big trials, but not in surgery. So that was a big deal. So we're all kind of learning together. And the biggest thing is there isn't a guarantee beyond funding beyond that. In research, the biggest challenge, I think, as you articulate for coordination, is you are trusting in the ideas and the team to go forward. And so there's an element of bit of risk taking, I would think, right? Like that's kind of how you probably are envision it. But when you got in, were there ever times where you thought this was the wrong?
I had 1 year work experience. I remember my first year I saved all the files with no year date on them. So there were little like hiccups like that. I sent out probably a few pretty non-professional emails because my writing. I remember Gordon correcting my explaining active and passive writing to me.
And passive tense, right?
Yes. So there was a lot of moments where I was like, I was so in over my head. But then there were other days where it was so great, and most days were so great and rewarding. Right. And then I did HRM, and I found HRM was a turning point.
So when did you decide that again, like time-wise?
I finished it in 2004, so I must have started it in like 2001. I think it took me 3 years because I went slow and wanted to get. I've always been kind of one to go slow with education and get stuff out of it versus just get the degree and.
So that's actually a pretty important point too, right? Because there's the psychology of saying I want to get all my graduate work done, and then I want to start my career, or I want to get going. It's almost the concept of work placement. Get in there, apprentice, start doing stuff, and then
I think
use that.
Like my take on that is HRM would have been very, very hard. Very, very difficult straight out of undergrad. And I know we talked a lot, and every course I did, I was able to come up with a project that was applicable to our work together at the time, and I get a publication or a grant or something out of most of the courses.
So that's actually a pretty good point.
And I found it really filled, like HRM really filled in the gaps for me on the language, and because sometimes you use all the words, like you say, intention to treat, but you don't really know what it, and then you don't really know what it means, or
and speak to this, like speak to the feeling of being at McMaster. Again, remember, like if you look at the historical context of this, so and we use the word HRM again for those who aren't familiar. For those who aren't familiar, HRM was Health Research Methodology, which was the master's program at McMaster that was targeting basically the development of those clinical research skills. But imagine the time in where 1990 roughly, right, is where is the storyline begins, where you hear stories of, Gordon Guyatt and others, Brian Haynes and David Sackett, and these amazingly
privileged to know them all.
Important individuals in the history of evidence-based medicine, coining the term in 1990. We getting there, like really five years into it is just you're just like, you can see the movement is happening, and you're starting your master's around the time where things are just humming, right? Like McMaster is becoming the epicenter for this. What was it like learning the new language, but for your perspective, being around individuals? Like, did you have a sense of how important that period in time was going to be? Did you have a sense of how important Sprint was going to be? And Sprint, again, was the first large, over 1,000 patient randomized trial. Back then, that was collaborative between Canada, the US, and Europe. That really hadn't been done like that before.
Yeah, it was great to be part of something. I was fortunate enough to be supervised by Deborah Cook for my master's, and have the opportunity to get to know and work with her, which was wonderful.
Right.
And to be part of Sprint was like something new, something different, something that someone hadn't done before.
Right.
So I think that's what I really liked, is that it kept me very interested, learning more. Right. And wanting to do very, very well at it.
So let me ask you this then. When you think about a checklist, right? So we said go back to things that advice you had been given. You think about checklist. If you're starting in this and you're thinking so you're speaking to all the individuals who are either graduate school or they're just finishing or they're undergrad, and they're thinking, I've heard about research. And I know people who are doing research coordination or research assistant or associate, whatever terms we talk about. How do you, what is your advice to them to say, these are the reasons you should consider this? And also, I'll ask you a follow-up question, just keep in the back of your mind, is how do you know that first job you're taking is the right one? Right, it's kind of like how do you mix and match the environment? So if you want to be successful, what are the questions you'd ask someone early on to understand that they may be able to help you through what you kind of experience, which is the opportunities to grow and all the things you want. I'm not saying I'm not saying your first job should be the perfect job.
I think I was lucky enough that my early jobs were the perfect job for me. I think a lot of it is just working hard. Continuing to learn and improve yourself. Another course I took in HRM was with Charlie Goldsmith. So
he's a prolific biostatistician and epidemiologist at McMaster.
And he taught me the concept of continuous improvement.
Okay.
And that continuing your education, and that you're never gonna know it all, or there's always more to learn. And I still feel like I'm at that same stage in Sprint, like 20 years later with these with our aqueous prep and prepare trials.
Right.
We're doing the first large cluster randomized trials in orthopedics.
And you feel the same way.
So I'm still learning,
same pit in your stomach.
Same pit in my stomach, same excitement that I can't wait to get up in the morning and
get on with it.
I'm still taking more courses and continuing to learn, and still learning from my mentors from 20 years ago.
Let me ask you this then. So what do you perceive are, not everybody, like I always say, not everyone should do everything, right? So who is, in your mind, the person that should say, these are the general characteristics of an individual that will be highly successful in the research career? And the research career can be anywhere from starting off as an assistant, going all the way up to where, to running your own research program, which is basically what you're doing. So you've seen it all.
It's a hard question, because I think everyone comes in from a different path.
Right.
Like there isn't there's different undergrad programs, and now there's getting to be more research coordination programs and associations and such, but there isn't really like a job fair at high school saying,
so there isn't a particular undergrad course you would take, or there isn't a particular thing.
A lot of courses touch on, and I don't know all the disclaimer, of course. I think a lot of courses touch on research. I know a lot of psychology courses does some of the but I don't think to my knowledge, there isn't an undergrad course for becoming, like at the university level, for becoming a research coordinator. And I think like HRM takes in some research coordinators, but it's also targeted towards physicians and other people too. So I think it's not a clear path.
Well, then, are there, just personal characteristics that a person might hold. So one thing that you've said a few times is, work ethic. And I know you, right? And we, I think both of us in some degrees probably we worked well together because we both knew that the job had to get done. And we had slightly different approaches to the same task, which meant that we were complementary, not necessarily antagonistic. Right? That's pretty important. But I get the sense from you, work ethic is a big important. So someone who wants to work, but you also mentioned,
you have to want to be there, I think is
right. And you also said lifelong learner, right? So presumably somebody who always takes education and learning as just a joy rather than a task.
Yeah.
Is there any other thing that separates people you think are likely going to be, or coordinators you've met that have been highly successful? What are they like?
Everyone has different, there's so many different tasks or jobs associated with research coordinators, because you can be in the clinic, and some people are just wonderful with patients and enrolling patients in studies and doing the follow-up and such. Other people design the protocols, the case report forms, and do that piece. And then there's also the statisticians, the medical writers. So there's I think there's lots of different jobs, and I almost think we're at a bit of a loss in that we aren't promoting it young.
Okay, we have to do more to promote it young.
Yeah, my daughter likes math. I'm like, oh, you should be a statistician.
Right.
She's little, but I'm like, that would be a great job for you.
And we need her.
And we need you in my office.
We need her in our office, absolutely. Well, good. I know exactly what you mean. Okay, that's very, very good.
Yeah.
Well, so I've been asking all of our guests about a couple of things. One is, what are the types of things they do that give them great joy? So, the 20-80 rule, which is 20% of the things we do gives us 80% of our true joy. And oftentimes I try to get you to focus on things that don't directly relate to your day-to-day job, because your job, I'm sure, gives you joy, but we're trying to find the other things. That's one question. And the other question is what do you do when you get up? So maybe we start this.
Okay.
What's your morning routine like? What time do you get up? And kind of walk me through the first 2 hours of wake time.
Okay. Well, I wake up anywhere between 4:30 and 6.
Oh my gosh. Okay.
Well,
very early.
I don't need a lot of sleep.
Wow,
I've always been...
Okay, so let's say you get up on a 4:30 a.m.
On a 4:30 a.m.
What are you doing?
I take my computer and I sneak downstairs to not wake up my children.
Yes.
I make a tea and I get the day going. I start my my emails.
So is the first thing you're doing is you got your tea, you open up your laptop, and you're going to emails, or are you going to your handheld? What is the...
Usually I skim on the phone so I know what's arrived overnight and what's on the list.
How long do you spend on the emails or the morning
until the children wake up?
Which would be an hour?
7-ish.
Oh, okay. So you get quite a bit of work done.
Yeah, and if they come down a little earlier, then they'll sit on my knee, or I'll put the work aside and see what they need. And
got it. Okay. Yeah. And then you will get them ready, and then presumably you'll get ready yourself, or
we all kind of get ready. They're eating almost 6. Carly will be 6 on May 5th.
Right. Okay.
So they're pretty independent, but I keep an eye on the routine. Help them and stuff.
Yeah. Of course. Okay, got it. And on days that things are going well, how does that 2-hour session, in other words, if you didn't do those 2 hours, would that create anxiety for you versus, I can do some other time? In other words, if you didn't know those 2 hours, what would you do?
Yeah,
and the reason I say this,
because
the reason I say this is that I've been reading and I've been asking, and everyone has their own routine. There's no right one, by the way. There's no right, I do the same thing. I have a tendency to want to look and connect with the world quickly. And I'm thinking in hindsight, maybe the morning should be not about connecting and just connecting with my own thoughts or whatever that may be, right? Sitting up, having your tea with nothing, right?
Nothing.
So, the question
I'm not very good at doing nothing, Bo. You know that.
Yeah. So if you didn't do it, could you do it? I guess the question is...
I don't know. I feel like I just like it because then I have everything caught up, and then it's I can kind of relax with the kids. Sometimes I'll take a break and go to CrossFit after I get the kids to school.
Okay, so then you do some other activity. So I kind of flex my time in the morning. Yeah.
But then it's also kind of works well because then I've replied to everybody. When everybody else gets to work, they have what they need from me.
Yeah.
I'm not the rate limiting step or slowing anyone down.
It's efficiency for you.
Yeah. And sometimes I'll take a few calls in the morning if somebody needs something.
Very cool.
It works for me.
Okay, so then what do you do? What do you do to outside of your work life? Outside of work life, activities you do, things that give you some degree of joy and satisfaction.
I love to travel.
Oh yeah, right. Okay.
So I travel quite a bit.
Yep.
We go to the cottage.
Yep.
I go to CrossFit. I spend a lot of time with the kids because they're at a really fun age right now.
Oh yeah.
Yeah.
And so you try to do things with them as well.
Yeah,
right?
sometimes they're just like the chauffeur, you know.
Yeah. Oh, I know that story. Yeah.
Planning their little social lives and stuff, which is great.
And is there anything you want to do in 2019 that is something you haven't done? Is there something on your list to say, this is something I want to try, haven't tried?
We're doing a family trip to Europe.
Oh,
so myself and the girls, my 2 daughters, and my parents. So
that's going to be awesome.
To Europe for
and
a
where
week
in Europe
together.
are you guys going?
Copenhagen.
Oh,
so Denmark,
awesome.
and then we're going to do a day trip over to Sweden.
Awesome.
Kind of something.
Right. So you'll try the saunas. I've tried the saunas. Very good.
Should be fun.
Good. That's excellent.
It's like a family trip.
Anything else you want to add around any of the stuff we've talked about? I think I've got a pretty good idea. And we'll have probably lots to talk about. And I'd like to get you back to talk about the anatomy of some of the big trials. So I'd like to have a big session at some point on sprint, you know, the sprint trial. And the sprint trial is particularly important to understand because the sprint trial, there were many times that I thought that trial was never going to happen. And I remember you thought the same way. And you know, it gets published, people see the publication, say, wow, this is great. And there's so many amazing people involved.
Exactly.
To talk about them and what they meant to that study, like each and every one of them on the steering committee were critically important. And that changed everything for all of us.
And I think with all of them, we still have, with many of them or all of them, we still have ongoing collaborations.
Right. So if we think about people that we definitely have to connect with again, is Paul Ternetta, Mark Swinkowski, Emil Shemich, Dave Sanders, you know, Stephen Walter, who was the statistician, Gordon Guide, who will absolutely get on board, or just to name a few of the really, really important and pivotal individuals who helped us in that trial. I'm going to try to get them all to join us. Hopefully we can get them physically here. If not, we'll get them on the podcast.
That'd be great.
Awesome. Well, thanks so much, Sheila. It was great chatting. I'm sure we'll have lots more to do today, and we'll get you back on your emails. Thanks for watching OrthoPod. Stay tuned for more episodes.